today about swallowing difficulties after stroke. Dysphagia. You might hear this term used by one of your medical professionals. Today we're going to learn, what is it? How does it affect me? Some signs of difficulty, and what you can do about it. So dysphagia is the medical term for difficulty swallowing. It may be temporary or permanent, and it occurs when a stroke affects the area of the brain that controls the muscles of our mouth, tongue, and throat. Swallowing problems can lead to many serious health consequences, including swallowing food, swallowing liquids, coughing and choking, not being able to eat, dribbling and drooling, and trouble chewing. Problems can occur in one or several phases of swallowing. You might experience difficulty chewing your food, moving the food from your mouth to the back of your throat, moving food through your throat, and finally moving it down into your stomach. Now, aspiration is another word you might hear. And aspiration means when food or liquid or saliva passes below your vocal cords and into your airway. And this can be very dangerous. Bacteria carried in food, liquid, or saliva can lead to an aspiration pneumonia. Now, normally, your lungs are protected by a cough when food or liquid goes down the wrong way. But sometimes, after a stroke, your body's ability to protect itself is compromised, and you may not have a strong cough or a cough at all to help defend yourself. Now, what are some signs and symptoms that you or a loved one could be having a swallowing problem? You might notice difficulty taking food from a spoon. You might notice excessive saliva or drooling. Some might report a poor sense of taste. You might notice they're having difficulty chewing because their dentures don't fit well. Maybe you'll notice pocketing of food in their cheeks or in between their gums. You might feel the sensation of food sticking in your throat. Throat clearing is a big one, or coughing or choking. This can mean that liquid or food may have gone down the wrong way. Also, listen for changes in your voice. Does it sound wet, gurgly, or hoarse when or after you're done eating or drinking? You may also notice a gulp when you swallow. That can let us know that your swallowing is weak. Problems breathing or shortness of breath is very common when someone is having difficulty swallowing and is very serious. That can lead to chest congestion or infection. Now, if you notice any of these signs or symptoms, please let your nurse or other healthcare professional know. What can be done if someone is having difficulty swallowing? First, we could change the consistency of food and liquid. Now, if someone's swallowing is delayed, which is very common in stroke, sometimes thicker fluids are recommended. Now, thicker liquids move slower and are less likely to go down the wrong way. We may change the texture of your food. Now, for example, pureed foods are easier to swallow and tend not to stick in the mouth or throat. Minced foods do not require as much chewing and preparation, and so may be great for someone who is missing teeth or having difficulty moving the food from the front to the back of their mouth. Now, here are some different texture options that we have here at RVH. Let's talk about solids first. So we start off with pureed solids. Think about mashed potatoes, nice and smooth, no lumps. These are considered the easiest to swallow. Next, we move on to minced food or chopped food. This can be considered the texture of ground beef. Moving from there, we have soft solids. So think about cooked veggies versus raw veggies. Again, easier to chew and manipulate in your mouth. And then finally, regular foods are usually sent to patients or people not having any difficulty swallowing. Now, looking at the other side of the screen, we have our liquid consistencies here at the hospital. Pudding thickness is the thickest of all liquids, and these are usually set aside for people having severe trouble swallowing. Next, and less thick, would be honey consistency, and as its name implies, would be the thickness of honey. A little less thick is nectar thick. You can think about nectar thick fluids being the same as about a tomato juice, so slightly thicker than water. And finally, thin fluids, which is the consistency of juice, coffee, tea, your regular fluids that you would normally consume. Now, what can you do if someone is having trouble swallowing? Another strategy is in order to reduce risk of aspiration, would be to ensure that people are sitting upright when they eat. It's also important to ensure that you're taking good care of your mouth. A clean mouth will help reduce complications if aspiration occurs. Safe feeding techniques are important. So this means feeding slowly, maybe only taking half teaspoon at a time, trying to limit the amount and the speed at which you eat. And finally, in some cases, swallowing exercises are indicated and will be prescribed to you by your speech-language pathologist. Now, sometimes when people are having extreme difficulty with swallowing and it is not safe for them to eat or drink, they may be required to have a small tube placed into their nose or directly into their belly to give them food or liquid. Now, this may be temporary or permanent depending on severity. Again, just to review, there are different things you can do when you're having trouble swallowing in order to help keep you safe. As I mentioned before, make sure you're sitting up straight, not lying down while eating and drinking. Take small bites of your food. Chew well. Take your time. Try swallowing twice before each bite or sip. That can help clear residues in your throat or leftover food that didn't go down on the first swallow. It's important not to talk when eating. Just focus on swallowing. And as I mentioned before, clean your mouth. It's very important. It's even better to clean your mouth before and after you eat. Check for food in your mouth after you have eaten. Again, as I mentioned before, people who've had a stroke are at increased risk for pocketing food. Now, this is because sometimes people have less feeling or sensation on one side of their mouth, and therefore it's more likely that food may get trapped in between your cheek. Now, this is dangerous because if you were to go and take a nap after you've had a meal and fall asleep with food in your mouth, this could put you at an increased risk for choking. It's important after you've eaten that you keep sitting upright for 20 minutes. Again, this is important if you have leftover food left in your cheek or your throat. By sitting upright, gravity will help play a role in getting into your stomach safely. Always follow the recommendations made by your speech-language pathologist. These are located on the yellow sign placed above your bed. And if you have questions, feel free to ask any member of your healthcare team, or especially the speech pathologist. Now, what can family and caregivers do? Ask questions about diets and recommendations made. Check with nursing staff or SLP before bringing in foods from home. A lot of times, patients may not like the food served here at the hospital and may request items brought in from home. This is okay as long as the food texture and consistency is safe for them to swallow. We encourage you, if you're having swallowing difficulties, to try and feed yourself. This is very important in your therapy. Again, just as a reminder, make sure you're sitting upright. Give yourself small bites. If you're a family member caring for your loved one and want to help feed, make sure that you sit at eye level with them. And remind your loved one also and yourself to clean your teeth. Again, cannot stress that enough in dysphagia or difficulty swallowing. So think about it. How has your swallowing changed since your stroke?